This machine behind me here is called the Anesthesia machine. It is the machine that will breathe for you during surgery and keep you under general anesthesia. And when I roll a patient in the operating room, I have never even once in my 10 years of doing anesthesia had a patient look over at this machine and say, "Ooh, what's that? How does that work?" So I'm going to tell you how it works. There are lots of screens on this anesthesia machine. I'm going to tell you what each one does. This one is where we do our electronic charting during the case, where it monitors all the patient's vital signs, all the drugs we give. This computer is where we can go in to look at patient's health history and we can place orders for the patient. This monitor controls the ventilator that will breathe for you during surgery. There's a lot of different settings on here, different modes of breathing that you can see here. Volume control, SIMV, volume control, pressure control, volume guarantee, SIMV, pressure control, and a couple other great ones there. Down here, this is called the vaporizer. This is probably the heart of the anesthesia machine because it contains the liquid that will keep you under general anesthesia during surgery. The way it works is it gets heated inside this vaporizer from a liquid into a gas. It travels all the way out of this breathing circuit. This breathing circuit is connected to your breathing tube that is down in your trachea. That gas goes down your trachea to the bases of your lungs where it's absorbed by your bloodstream, travels to your brain, and keeps you under general anesthesia. That's the way you stay asleep during surgery. The time when you're under general anesthesia, the ventilator will be breathing for you, and that's under auto mode. But if we want to, we can flip it over to manual, and that turns on this green bag where we control your breathing by how often we squeeze it. And this little thing here is called an APL valve. This controls how much pressure is in the circuit when we do that breathing for you. By the time that surgery is over, we have gotten most of the sevoflurane out of your body. That's the stuff that this vaporizer puts out. And we will switch this bag into manual mode, and we will squeeze it and help you as you begin breathing on your own until you can fully take over your own ventilation. This is the bed that you will lay on during surgery. This is a remote control that controls all sorts of different movements that bed can make. And right above are the lights that I am constantly hitting my head on. Let me know if you have any questions in the comments. I think it's pretty cool to know on a basic level how that machine works.